Knox Community Health Service, nestled in the foot of the Dandenong Ranges, delivers a variety of services that improve the physical, mental and social well-being of the individuals, families and communities in the City of Knox. One of these services is the Alcohol, Tobacco and Other Drugs Counselling Team. Sitting within this part of the service is the Improved Services Initiative, a federally funded initiative which aims to provide an improved, integrated response to individuals with co-occurring mental health and alcohol and other drug concerns, also known as dual diagnosis. In this film about the journey of capacity building to capability, you will hear real stories from KCHS in which their staff and the staff from some of the key partner agencies talk about the ways in which this initiative has had an impact upon their work with consumers and their families, experiencing both a mental health and an alcohol and drug problem. You will also hear from the perspective of consumers and their families as they share about the way in which Knox Community Health has responded to their needs. Knox Community Health has developed an approach to capacity building and integrated care which can be easily replicated and which may be of interest to other services going through a similar journey. The film is divided into 4 sections: screening, interventions, training and consumer perspectives. You can watch the entire film in one sitting or view one aspect of the capacity building story. It can be viewed by individuals or groups to support increased understanding, agency discussion or as in-service training.
Hi Jenny, this has been a great collaborative activity between Knox Community Health, Alcohol, Tobacco and Other Drug Service and the Eastern Dual Diagnosis Service. Can you talk a little bit about what we're hoping to achieve by making this film?
Well, the main aim really is hopefully to encourage and inspire other agencies, other service providers who are endeavouring to improve services for people with co-occurring mental health and alcohol and other drug concerns. And we feel that we've kind of hit on a model that's really working for us. It's a very smooth, integrated team approach to working with co-occurring conditions. And we remember very well what life was like before the improved service capacity building. We really didn't have adequate screening tools, risk assessments. We certainly didn't have partnerships with mental health services. We didn't have a vocabulary to even communicate with mental health services. So there was a lot of frustration and at the same time a desire to really be able to provide a great service for people who were quite complex in terms of what they were experiencing in terms of their mental health and alcohol and other drug concerns. So we really have come a long way and we have very, very strong partnerships now with mental health services. We've endeavoured to improve our clinician experience by training, and we've invited mental health services to join with us in that training. So we now have a harmonious therapeutic approach. We have got to know one another face to face through sharing together in training, and that's really helped to strengthen our relationships with the people that we'll be working with in order to provide a team approach to someone presenting with a co-occurring condition.
So I mean, this has been a really good example or a great opportunity to showcase, I guess, the journey from capacity building to dual diagnosis capability.
Yeah, we're really proud of what we've achieved, and we really want to acknowledge that this is about real staff, real consumers, real services in the Eastern region who have successfully partnered, and I guess that's the exciting thing, is that it is possible for alcohol and other drug services and mental health services to partner together, to have a unified approach, to have respect for one another's expertise, and to really provide a great experience for the consumer presenting with co-occurring mental health and substance use concerns.
Capacity building involves the development of sustainable skills, organisational structures, resources and commitment to health improvement in health and other sectors to prolong and multiply health gains many times over. It can occur both within a specific program and as part of a broad agency and system development. New South Wales Health, 1999. Dual diagnosis capability can be defined as alcohol and other drug and mental health practitioners delivering a range of innovative problem-solving approaches using skills and techniques appropriate to the experience of the practitioners and their place of work, which in turn provides a service provided to consumers and their families experiencing co-occurring alcohol and other drug and mental health problems. Gavin Foster, 2011. In alcohol and other drug and mental health services across the country, co-occurring mental health and substance use concerns have been recognised as the expectation rather than the exception. We also know that consumers experiencing co-occurring conditions have had poorer treatment outcomes and increased risk to health and well-being. Therefore, it is essential that both alcohol and other drug services and mental health services have the capacity to provide appropriate services to the individuals and families with co-occurring issues, including an integrated treatment response. An important part of capacity building within service systems is the systematic identification of co-occurring alcohol and other drug and mental health problems. For that reason, Knox Community Health Service has implemented the modified mini-screen to identify co-occurring mental health concerns, and their local mental health service partners have implemented the Assist screen to identify alcohol and other drug concerns.
So initially, we'd introduced a side check at Knox Community Health Service, but they had decided when they saw the mini modified screen that it might be more useful to their counsellors, as it had information about psychosis, that they might be screening for psychosis as well, as they were seeing many presentations within their service that would indicate there may be some psychotic features.
I let the client know before I do the MMS with them that at the end I'm going to tell them what it's telling me, because at the end of the MMS I want them to tell me if that fits their experience of themselves.
It gives you a solid idea of what areas the client might be experiencing mental health difficulties in. It also encourages a nice conversation. So, well, I enjoy it, and clients seem to enjoy it because the way I do it's fairly, we do the screen and then we have a bit of a discussion about the results and how they feel about that. So it kind of brings all that stuff out into the open, like it's not something to keep secret, it's just something to talk about.
The mini has been really helpful for me because what I've noticed is that I refer much less to triage now. So maybe 3 or 4 years I think I was contacting triage much more regularly than I am now and have been in the past year and a half. So yeah, that's made a big difference, and it's really given us an opportunity, and me an opportunity to clearly identify what you're dealing with. So if it's anxiety, if it's depression, or if it's something else, as opposed to kind of it being a kind of broad, cloudless mental health issue. It's something a lot more specific.
So that's helpful for me because when I do a referral, say to primary mental health team, I've got a basis to do that referral on. It's already saying to me, I've got concerns here about anxiety, or this is sort of suggesting that the client's got concerns here around depression.
I think having the screening tool points you in the right direction, and then you know what to what areas need further assessment, and that provides you with further clarity. And without that screening tool, it's a bit more hit and miss. Yeah.
We started using the Assist tool, and we found it really good because it helped us have a conversation with people. It gave us a forum to work with.
All of the staff have been involved in some dual diagnosis capability training that each was running, and extension of that was actually doing the Assist screening tool to screen regardless, so there's no wrong door for people that have drug and alcohol issues. There's a large crossover where we have common clients with the mental health services, with drug and alcohol services, and using the Assist as a way for us to have that conversation fairly early on.
You know, I've recently had some training on it in dual diagnosis, and that was great because it can, it's kind of a double-edged sword because it can seem quite a formal tool. It's a lot of questions and answers, and it can be a bit intimidating, I guess. But yeah, look, I think the more you use it, the more it can kind of become a springboard for sort of you know, broader engagement.
A lot of the clients that we work with do have the dual disability or comorbidity, so with working with the assist tool, I mean, I usually say to people, look, it's not to judge you or anything, it's just to sort of assess where you're at, and a lot of the clients have actually gained a lot of insight themselves. One gentleman in particular that I used had a very high cannabis, and he pretty much used everything apart from, I think it was caffeine or something. So it really identified, there was a lot of drugs that he actually used, a lot of substance that he used, and he wasn't actually aware of that himself. He just thought he used more cannabis than anything else, but it actually identified to him where he had other areas of needs that he really wanted to work on. So it really identified that, and it's a non-threatening manner too. So you can sit there with a person and just talk about it, and fill in the form, and then at the end, sort of, it just identifies the area. And sometimes people aren't even aware of those areas of needs too. So it's really given a lot of awareness for myself as a worker, as well as for the clients that we work with too.
Assessment tools for both mental health and alcohol and other drug issues need to include thorough exploration of both mental health and substance use concerns, including the risks associated with co-occurring conditions. After training with an Eastern Health mental health triage clinician, KCHS were able to implement the Clinical Risk Assessment and Management Tool, a standard risk assessment for clinical mental health services in the Eastern region.
What the CRAM's done for me is give me a very clear sense that we're on the same page with mental health services. That is one of those tools, I suppose, that crosses the paradigms, that brings that work together, where if the mental health service is using the same form, we can clearly look at that and say, well, this is what the risks are and this is how we're responding to them and who's responsible for that.
We also did a CRAM risk assessment, which was great, really assessing the person's level of risk, which would then obviously inform how we would go about developing a treatment plan.
We sort of do the CRAM, or I tend to do the CRAM at initial assessment stage, and that just helps me tease out whether there's any current concerns for the client around self-harm or any suicidal thoughts, so that we can manage that early in the piece. So it is a useful tool, and without it being there, I think sometimes it can get forgotten, and it's not necessarily something that the client is going to raise with you, so I think we have a responsibility to actually raise that with the client. And by applying the CRAM to every single assessment or every client that we see, we're not sort of picking out individuals to do the CRAM with, it's across the board. So we're not singling out anybody in particular, so it's across the board.
Mental health services used integrated recovery plans, or IRPs, to support client-directed goals and to provide clarification of roles and responsibilities, and to also provide cross-service collaboration where more than one service is involved in providing assistance. Knox Community Health AOD team have embraced IRPs to support client-directed treatment plans and clarification of roles and responsibilities. Joint sessions with the AOD worker and mental health worker to prepare IRPs increase clarity for the client and service providers and gets everyone on the same page and working as a team with the client for the client's goals.
Well, the IRP is called the Individual Recovery Plan, and the way I see it, it's a document that helps support our work with a client across services in order to improve outcomes for them. So it's about setting up with the client the goals that they'd like to achieve for their health, and may that include substance use and mental health and other areas such as accommodation and other matters. So the real benefit is that document, once it's developed with the client, it's then shared with the client's consent across a range of different services. And then we can all contribute to that, each individually working with our client to add what we're working on. And the clients that I've experienced using that with find it really helpful. They find that all their workers are on board working together just to help them. And everyone knows what's going on, so they don't have to repeat their story on who's doing what.
Yeah, I'm a big fan of shared care. There's been a big push, particularly from Eastern Health, in shared care and the IRPs and everyone being a part of that. And I think that it's worked very well. And I think we're having much closer ties with Alcohol and Drug Service and also with area mental health services, which has been great. So everybody knows what